Practice educators and the practice placement is vital for our students for so many different reasons. Until they get out into practice, they don't know how to make that link. They can't contemplate how that is connected.
It's sort of bridging the gap between what they learn in university within their first couple of weeks, and then they sort of have a real feel for it then when they leave us after their first placements.
We're able to help and support the students and be able to nurture them into applying all the practical abilities which are taught in a classroom setting.
When the students go out into practice, that's when they are able to adapt what we've taught them, to hone their skills and to turn that theory into practical knowledge, to be able to practice with a safeguard of an educator next to them.
We need to motivate them, we need to challenge them, we need to demonstrate what it is to be a professional, and hopefully what they learn academically as well will encourage them on placement to achieve these standards that we set out.
There's so many different aspects to becoming a paramedic, and practice educators play a fundamental role in helping with that. And so we'd like our practice educators to be the best that they can be for our students.
I would definitely recommend staff to become a practice educator.
The rewarding parts are obviously seeing the student achieve, watching them nurture and grow as individuals, and a lot of the students that I mentored are now working within WAST, and to see how they've flourished and gone on to achieve bigger and better things.
It is something that, you get a good buzz out of the fact that you've been involved in that in some way. So I think it's such a positive thing to be involved in.
Students are always asking questions, and more often than not, you find that you may not know the answer to the question. So it does help yourself because you end up researching things which maybe you didn't think of before, and it's a learning process for both yourself and the students really. It's a sort of reminder that you need to keep on top of your clinical practice and be able to actually explain to students why we're doing what we're doing.
It allows them to keep on top of their knowledge skills, because if they're having a student out, they need to ensure that they're maintaining their knowledge base. It gives them leadership qualities as they're managing these students in placement. And I'm hoping it encourages them that they can see the importance in education, because they are playing a vital role in educating the paramedics of the future. The students that are coming out, hopefully they are going to become employees. So from a student perspective, we are involved in the training of future paramedics.
The students who come to Swansea are particularly at an advantage. They get to know the vehicles, they know the staffs, the stations, down to the door codes and how to get in. It's almost a clear transition from being a student into actually working on the road.
We have the opportunity to ensure that we can instill our values and beliefs on these students.
Ultimately, they are going to be the ambulance service of the future.
When it comes to educating and training, we've got very little that we need to update them in. When it comes to induction programs, they've had 2 years of experience. It is nice that the experiences that they've had on placement are actually encouraging and positive enough that the students want to remain in Wales and not go and seek employment elsewhere.
We're there to help support and facilitate them signing off their clinical competencies.
We're not going to come across every scenario, so it's been able to identify what gaps are in that student's knowledge, trying to fill them and allowing them to successfully complete their documentation.
If you find that your student is struggling with an aspect of their knowledge or an aspect of what you think they should know, then we'd like that to be addressed.
It's really important that students are given honest feedback regardless of whether they perform well or they haven't performed as well on a job.
It's part of a learning process for them and growing process.
We want you to be absolutely honest with yourself and with the student. If you don't think that they are suitable to be signed off, then please don't sign that aspect off.
Paramedic's a protected title, okay? Everyone who's achieved that has worked extremely hard to achieve that registration, to achieve that title, and it's important for us that we ensure that when we deliver education, it's to the highest standard, because we are providing a service to the public, and if those individuals are not up to the, I won't say challenges, but if they're not up to the standards that are requested of us, then we shouldn't be signing them off.
I don't think there's a single way to manage students. I think being quite flexible really is probably the best thing for anybody who's a new practice educator.
Make sure that you're patient. Understand that these are guys who necessarily would not have had any exposure to the out-of-hospital environment. Be resilient and ensure that you take time to know your student.
Speak to your students, try to find out about a bit about their background. Speak to them before and after events. Speak to them when you're on station, when you're checking your equipment. Try to get a rapport with them, try to find out what makes them tick.
One student who you've had previously in the same year is going to be at a completely different level to the same student in a different year, or even the same year. And you have to adjust your sort of mentorship ability.
Try to make it as interactive as possible, so allow the student to get involved in the patient's treatment where appropriate. This will encourage the student to use the skills and knowledge. There's nothing worse than a student who feels left out. They're quiet. There is no camaraderie between yourselves and them, and it becomes very difficult to save that situation. So involving the student as much as possible where appropriate.